Good afternoon. I am Candace Sims. I am the program manager for Crime Victims Advocacy Council. And today I am so grateful to be able to have two friends with me today. And we're going to talk a little bit about the coronavirus vaccine and the science and the safety behind it. So, my guest that I have with me is our executive director, Brooks Honeycutt. And I also have with me Dr. Clarice Wimberly. She is a public health specialist specializing in drug safety and surveillance. Did I say that right? I wanted to get that
Yes,
right.
yes,
Okay,
absolutely.
great, great. We are going into our pretty much the second year of dealing with this global pandemic. And now that we have a vaccine that um, will help us to keep us safety, I understand that there are to help keep us safe. I'm sorry. I understand that there are a lot of concerns and that there are a lot of cares and worries from our clients and from people who follow us on obtaining the vaccine. Who should get it first? Who shouldn't get it? Why should we trust it? Because it happens so quickly, and just all kinds of questions. And I've even had concerns myself. But I'm so grateful to be able to have two people who have shared their experience and expertise with the vaccine. And I wanted to invite them on a short, quick, brief um, Zoom video to share their information to give to you to kind of help decrease some of those cares and concerns. So, Brooks, I would like for you to share first and foremost just your knowledge about viruses and why you trust the science behind the coronavirus vaccine.
Okay, hi everybody. I'm the executive director of the Crime Victims Council, as Candace said, and I also was a pre-vet medicine student. I did a lot of the prereqs and then I quit because I couldn't take the death part. But I learned a lot about medicine and I come from a medical family. My stepfather was an orthopedic surgeon, not to mention the fact that I've probably been in the hospital 20 times for all kind of stuff. I've had car wrecks and I've been, had crush injuries and all kind of stuff. So but I've had a lifelong interest in medicine. And the thing about the virus, people being afraid of the vaccine, first of all, I'm 76 and I've been here a long time and I've had a lot of vaccines. So I've never had any kind of adverse reaction. And yes, there are people who are allergic to eggs and allergic to some of the ingredients that are in the vaccines. But, the majority of people are not allergic to the vaccine component itself that fights the viruses and so forth. So I have less concern about this vaccine than I have others because it is the coronavirus. COVID is a coronavirus, and there are other coronaviruses we've dealt with in the past, SARS and MERS, and there's many more of those. So we developed the different medical companies developed vaccines for all of these, and so this is simply a variant on the coronavirus. So COVID-19 is a new one, but it's a variant. So there's a very small part of DNA on this virus that's different than the others. And so what they have done is isolate that piece of DNA. And I'm thinking the way most of it works, they inject another piece of DNA in there, insert it so that it can encourage your body to develop immunity to whatever virus it is. And so I'm not fearful at all. I'm looking forward to getting my vaccine. As a person who's had a medical background most of my life, viruses to me are much more dangerous than the vaccine. And just a 10-cent capsule, because we have a doctor on the screen. Viruses, to make it real simple, don't look like bugs and they don't look like bacteria because you can actually see the DNA in bacteria. But a virus looks like a little M&M, a little protein-coated unit floating through your body. However, it does have a locking bay and it looks for the correct cell in your body to lock to. Once it finds that cell, it locks at that locking site and it extrudes its contents into the cell itself, into your own cell. Once it enters your cell, that your cell is now turned into a zombie and it manufactures the DNA for the virus. So that's how viruses grow in your body and multiply. And so then once you get enough of those, multiplying and the cell actually explodes. I mean, once it's full of DNA, it disperses it throughout the system and is picked up by other systems, and it repeats itself until you have enough of a viral load that it makes you sick. And so if you get the virus vaccination, it will cause your body to mount an immunity before you encounter the real live virus, and you will be protected. And so that's why I have great faith in it. So now let's turn it over to the lady who really knows what she's talking about.
No, I think we're all experts and just kind of working our way through this. One thing I do want to add that COVID-19, the 19 reflects 2019, and this is really a novel virus in that it's new. We haven't seen anything like it. But because we've got previous coronaviruses, that's why it's easier to develop a vaccine, because we've already seen a lot of the similar components, but it's just these unique features for COVID that needed to be tweaked for this virus. And basically, as she said, the virus works by helping your body to build immunity to the virus that causes COVID-19 so that you don't have to be exposed to COVID-19 disease and get the full-blown illness. So it protects you from getting the full-blown illness because the vaccine causes you to create proteins that are very identical to the actual virus. Your immune system responds to that. And so when you're actually exposed to the real virus, your immune system remembers and this just shuts it down so that you don't get infection. And that's the way the virus works. And I just think it's really exciting. Usually it takes many years to develop a vaccine. But like I said, because we've seen this type of virus before, it was a lot easier to alter the vaccines that we already have. And, you know, I just think for me, I do safety work. So as you said, Candace, I'm a public health physician and I specialize in drug and vaccine safety. And with that topic, you kind of have to look at benefit versus risk. And we know the risks of COVID are severe disease and death.
Yes.
So the benefits of the vaccine to combat that outweigh any risks that I'm aware of with the vaccine.
Wow.
As Brooks mentioned, the most severe reactions we've seen so far are severe allergic reactions. And that's not to say other reactions will not be developed or identified in the future, but right now that's the most severe reaction we've seen. And it's an allergic reaction. And just, you know, for those who have peanut allergies and you travel around with your EpiPen and inject yourself with the epinephrine and it stops the reaction, that's the same the way you treat the allergic reaction to a vaccine. And when you get the vaccine, they have you stay for 15 minutes to observe you to make sure that you're not going to have a severe immediate allergic reaction. And then if you do, they can treat you right there. Unlike COVID, there's no immediate treatment, and a lot of people don't do well. They progress to severe disease and they're being hospitalized and on ventilators and die. And so the risk of a severe allergic reaction to me does not outweigh the benefit of prevention of severe disease and death. And so that's kind of the short version of it. And you know, vaccines do have some side effects. I don't want to misrepresent them that they're, you know, not without any side effects, but most of them are mild. They usually resolve within 24 to 48 hours. And a lot of them have to do with the actual site that the injection is administered in your arm. So there may be pain or tenderness or swelling. You may have some general body aches or headaches. But again, overall, they're mild. And to my knowledge, the most significant reaction to date has been severe allergic reactions. And I do drug safety and surveillance. And surveillance means that you continue to look for data over time. And so the more people who are exposed to this vaccine, the more safety data we will be able to generate to say, hey, here's the real safety profile of the vaccine. We don't know it right now because it's new, but as we learn more about it, we'll continue to update information and inform people so that they have an informed decision-making process to know what the full scope of the risks are versus the benefits. So I just think it's an amazing opportunity to stop the scourge that is really killing us around the world. You know, this is really a great opportunity. It was developed quickly, and now the next challenge is to make sure we get it administered to as many people that we can and help to address any concerns that people have about not taking it.
Mm-hmm.
Let's
Mm-hmm.
think about not taking it. That's the thing that concerns me because, okay, for example, many people who have the virus end up having breathing problems for a long time afterwards and low energy for a long time afterwards, which means their immune systems are not what they would be because it takes a long time to recover. Some people don't ever fully recover. There is evidence, that we don't have enough research on yet, but there's evidence that some people end up with permanent damage that doesn't go away. And how would you feel? I mean, you might say, well, I'm young, so I young people can make it through that just fine. That's fine, but when you go out without a vaccine, you're taking other people's lives in your own hands. Yes, you can be immune and and get contaminated with somebody else's virus and carry that on your hands and so forth, but it's much more contagious if you get it inside your body and you're coughing and spreading your germs everywhere. And um and so, how would you feel if you caused severe illness or even death of someone that you cared about? So
Right.
that's
Right.
my concern, even
Right.
over and above the fact that I'm older, is that I very much don't want to infect anybody else. And I would so much like to be able to go outside and know that I'm somewhat immune, so that
Mhm.
I can have that sense of freedom that we all enjoy so much.
Yeah.
So
Yeah.
I do encourage every one of you to look at it for yourself
Mm-hmm.
and really consider the facts, because this vaccine process has been around for a really long time. It's not a brand new one like when I was a kid and we were all getting the polio vaccine for the first time. We were kind of guinea pigs, but this is not the case here. And I encourage you to give it some serious thought to vaccinate
Yes.
yourself and your children and your loved ones.
Yes. So before we go, it seems like all of the information that you both have given, it 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 opened my eyes and made me more um, comfortable in wanting to get the vaccine and wanting to get in line and get an appointment to get the vaccine. So thank you so much for that. But I know a lot of times I hear people may say, "Well, I'm not going to get the flu shot because the flu will make me sick. The flu shot will make me sick." And so now I'm hearing a lot of people saying too that if they get the COVID vaccine, it will make them sick. Can any of you address that?
I'll speak to that a little bit. With some vaccines in the past, part of the component of it is a part of the virus itself. And that's one of the unique features of the two vaccines that we currently have available, is that they don't contain any of the COVID virus. So you're not being injected with the virus. So you're not going to catch COVID from the vaccine itself. What has happened and could happen is that sometimes you may have been exposed to COVID prior to getting the vaccine, and it doesn't manifest until after you get the vaccine. So some people think, oh, COVID caused me to get the vaccine. But the truth is you were exposed to COVID before you got the vaccine, and then the manifestations of the disease happen afterwards. So the vaccine does not cause you to get COVID. And if anything, if people do get COVID after the vaccine, the data and the studies have shown that they do not get severe disease. So even if you do get COVID, it's
Mm-hmm.
more likely to be mild than severe. So, and that's the thing, we
Wow.
have to get rid of the morbidity and the mortality related to COVID. Morbidity is severe illness,
Mm-hmm.
mortality is death. So at the
Mm-hmm.
very least, this decreases both of those. Not to say
Wow.
Also,
there's
you
no
want to
risk
remember.
or there's no chance of disease whatsoever, but thus far, the disease has not been severe if you do get it after the vaccine.
And you want to remember just what the doctor told us. It takes 10 days to 2 weeks to develop the immunity. Your body just doesn't suddenly whip out the big guns. So you see, you could get COVID and your body doesn't have the immunity built up, even though you've had the vaccine. So that's something to remember. And yes, there may be some momentary uncomfort. I had a guy who's a friend of mine who got the flu vaccine, and he was sick for 2 days, really sick, running fevers. But he was glad he got it. He's diabetic. He doesn't need complications. It passed really quickly. He just stayed in bed for 2 days, and he's fine. I would trade that for getting COVID any day.
Mm-hmm. Mm-hmm. Great. Great. Well, ladies, I want to thank you so much for just joining me to do this video so that we can get this information out to our distribution list. We here at CVAC have a mission and a vision to make sure that we are educating and that we are informing the public on safety measures and on information that will empower you so that you'll know what your next steps are, so that you'll be more clearer in what you need to do what's best for you. And
Let me
doing what's
just
best for
say,
you allows us to continue to do what we do.
let me say one more thing about that. Please remember, if you're a crime victim, your system is already stressed by releasing stress hormones because of what you've been through. So your immune system is compromised to begin with, depending on how far along you are after your victimization. So if you don't get the vaccine, you're probably much more likely to succumb to a more severe symptom of it because your body has used up the things that it needs to try to keep you well. So it certainly is, a pertinent thing for you to consider.
Hmm.
And
Thank you
Candace, if
so
I could
much.
just add one point is to
Sure.
do your research. There's a lot of information out there. Go to cdc.gov and look at the information. There's a website for at least one of the vaccines, cvdvaccine.com. So go look at the data. Don't look at blogs. Go look at the data. It's there to make an informed decision. And if you want to wait to see how other people doing it, that's fine. But just see this as a major benefit and major advancement in the elimination of this pandemic. So we
Hmm.
can all be free.
Yes,
Amen.
absolutely. Awesome. Thank you so much. We appreciate you allowing us to invade your space for the past 10 to 15 minutes. If you have any further questions for Brooks and I, reach out to us at www.cvaconline.org. And if your question is pertaining to any of the information regarding the COVID vaccine, put that in your message, and we will contact Dr. Wimberly so that she can advise us further.
Thank you for watching us. I hope you'll digest what we said and take it seriously.